See the osteology of humerus. Humerus is the vertical bone located in the arm. This is the largest and the longest bone of the upper limb. First, let's see the side determination. The rounded end, that is the head of the humerus, should be superior and the head should direct medially. The lesser tuberosity at the upper end should face forwards. So all these points suggest that this is the left-sided humerus. This should be held with our left hand. Next is anatomical position. The humerus is placed vertically in such a way that the head at its upper end faces medially, backwards and the upwards. Medially, backwards and upwards. Features of humerus: it has two ends, upper end, lower end, and a shaft. The upper end includes head, neck, greater and lesser tubercles, lesser tubercle, greater tubercle, and the intertubercular sulcus. Lower end, it is flattened from before backwards and it is expanded from side to side. So it consists of articular parts like capitulum, trochlea, and non-articular parts like medial and lateral epicondyles, coronoid fossa, radial fossa, and the olecranon fossa. Next is the shaft. Shaft is rounded in the upper half and it becomes triangular in the lower half. It has three borders: the anterior border, medial border, and the lateral border. And the shaft has three surfaces: anterolateral surface, anteromedial surface, and the posterior surface. The anterior view of left humerus. This is the head of the humerus. This is the greater tuberosity. This is the lesser tuberosity. And in between the greater and lesser tuberosity, there is intertubercular sulcus. This is the anatomical head of humerus, and this is the surgical neck of the humerus. The anatomical neck and the surgical neck. And here is the deltoid tuberosity, which provides the insertion of the deltoid muscle. And this is the shaft of the humerus. Coming to the lower part, this is the medial epicondyle, the trochlea, capitulum, and the lateral epicondyle. And this is the coronoid fossa. This is the radial fossa. And this is the lateral supracondylar ridge. And present on the medial side, this is the medial supracondylar ridge. Now the posterior view of the left humerus. This is the head of the humerus, the anatomical neck, surgical neck. This is the greater tubercle and the shaft. Here is the radial groove through which the radial nerve passes. This is the medial border. This is the lateral border. Coming to the lower part, this is the medial supracondylar ridge, the lateral supracondylar ridge, the medial epicondyle, trochlea, capitulum, lateral epicondyle, and this is the olecranon fossa, which provides attachment for the olecranon process of the ulna. Next is the proximal view. This is the head of the humerus, the lesser tubercle, greater tubercle, and this is the anatomical neck of the humerus. Next is the distal view. This is the medial epicondyle, and here is the ulnar groove through which the ulnar nerve process. Next, this is the trochlea, the capitulum, the olecranon fossa, and this is the lateral epicondyle. These are all the important features in humerus. Thank you.